So, hello friends, today we will learn about a very important developmental anomaly, that is taurodontism. So, if you will remember the definition of taurodontism, which is given by Whitcomb, you will remember everything about the taurodontism. So, Whitcomb defined taurodontism as a teeth with large pulp chamber. Okay, so as you can see in this diagram, that it is a teeth with large pulp chamber. Okay, so the pulp chamber is enlarged, and the bifurcation or trifurcation which is present, it is displaced apically. See, this is the bifurcation or the trifurcation which has been displaced apically, and the chamber has greater apico-occlusal height than in the normal tooth. So this is the apico-occlusal height is increased here in taurodontism. It lacks the normal constriction which is present at the CJ. So here there is no constriction which is generally present in the normal tooth. So in taurodontism there is lack of constriction which is present at the CJ. Because of this, the involved teeth, it presumes a rectangular shape. So when we see radiographically, it is seen as a rectangular shaped tooth. See. Okay. Now, coming to the etiology, there are many etiologies have been proposed for taurodontism, but the most common one is failure of HERS to invaginate at a proper horizontal level. Now, this you would have covered in DA. DH. Okay, so it occurs as a result of failure of HERS at a proper horizontal level. Now, very important question. Okay, distance from the bifurcation or the trifurcation of the root to the CJ should be greater or smaller. Answer should be greater or smaller than the occlusocervical distance. So it should be greater. Now what they are saying, distance from the bifurcation or the trifurcation of the root to the CJ. This distance, it will be greater than the occlusocervical distance in the taurodontism, because here it is called as bull-like tooth. Okay, bull-like tooth. Now there have been two classification have been proposed. Now the first classification, which was proposed by Shaw in 1922, based on the displacement of the floor of the pulp chamber. So there is a mild displacement, moderate and severe displacement. So mild displacement have been called as hypotaurodontism. This is hypotaurodontism. Mesotaurodontism, this is moderate displacement of pulp chamber, and hypertaurodontism, this is severe. This is moderate and this is a normal tooth. So you can compare, there is a mild displacement of pulp chamber, moderate and severe. Now in severe, what we can see here, the roots are almost fused. So in which type of taurodontism we see fused root? It is hypertaurodontism. Now very important classification and question can be asked from this topic. Okay, very important classification based on crown body is to root ratio. Okay, so this is crown body is to root ratio. Now here in taurodontism, we know that the bifurcation, this distance, the root distance is very small than the crown body. So based on this, they have classified hypotaurodontism. Now crown body is to root ratio here ranges from 1.1 to 1.29. Mesotaurodontism, here the ratio is 1.3 to 2, while in hypertaurodontism, the root is very small, that is almost fused root. That is why the crown body is to root ratio is more than 2 in the hypertaurodontism. Okay, so this finishes your dental dosage of taurodontism. Okay.